COVID-19 cases are increasing in India. It appears that COVID-19 is making a slow entry. If we talk about Thane, then total 30 COVID-related cases are registered in Thane Municipal Corporation limits. On 25th May, 11 cases were registered. And what is more concerning is that one COVID-related death has happened in Chhatrapati Shivaji Maharaj Hospital in Kalwa. 21-year-old Wasim Sayyad became the first COVID-19 related fatality. He was also diagnosed with diabetes. Right now, I'm in Thane's civil hospital. As you can see, these are the beds that are set up. This is the special COVID ward. 19 beds are set up at the Chhatrapati Shivaji Maharaj Hospital in Kalwa, whereas over here, total 15 beds are set up. See, this is the oxygen cylinder. These are the monitors. Various testing facilities are also available here. As you can see behind me, this is the special COVID ward that is set up. Right now, no patients are admitted over here, but in case of emergency, this special ward is set up. This is the oxygen cylinders, these are the monitors, these are the special beds that have been set up. We had a word with Civil Surgeon Mr. Kailas Pawar as well as TMC Chief Medical Officer Dr. Chetna Nitil spoke to Lokmat Times. Both have informed that all the precautionary measures, including the RT-PCR test kits, all are available at the Chhatrapati Shivaji Maharaj Hospital in Kalwa, and they have advised not to get panic but to stay alert. Also on Friday, a special meeting was organized under the guidance of TMC Commissioner Mr. Saurabh Rao. He has instructed that all the medical centers should be equipped with the testing facilities as well as the medicines that are required to cure the COVID. We have with us Dr. Kailas Pawar, who is the civil surgeon. Sir, first of all, welcome to Lokmat Times.
Thank you, ma'am.
Sir, in Thane, COVID cases are increasing, and what are the symptoms that are being seen in these patients?
Whatever cases are increasing nowadays in Thane, particularly because change of the season and change of the inverter, you can see there is a monsoon starting in the May. So this always we inform to the people when we had a COVID pandemic over there. We have to make the habit to stay with the COVID.
Right.
So COVID will be with us. Okay. But whatever we have tested, some people have came positive, but there is that virus, whatever this virus is circulating in the society or community, it is not that much toxic virus like that COVID-19. So it's a mild type of virus. So nothing to worry. There are only mild symptoms are there. That is whatever we can say, malaise, fever, body ache. The common symptoms are there, running nose. These kind of things are there, but nothing to panic, nothing to worry basically. This is not that much harmful virus, and basically we have got vaccination, we have got good immunity. So nothing to worry about it. And if something goes wrong, then we are ready for the thing. We have prepared the bed for Chhatrapati hospital over there. In municipal corporation, they are preparing their own hospitals over there. And we have all stock of medicine, PPE kits, VTM media, and all these things are there. Doctor, nurses, we have enough things to do to battle with the COVID cases increases or something goes wrong. But always we have to take care for the elderly people in our house and the people who are comorbid, whatever we call the people suffering from diabetes, hypertension, cardiac diseases, immunocompromised patients, cancer patients. They should take care.
Sir, but in Mumra, we have seen that a 21-year-old from Mumra, he died in the Kalwa hospital, Chhatrapati Shivaji Maharaj. So what was the reason for this death? Because it's being said that it's the first COVID-related fatality.
It's not a COVID-related fatality actually. He was a case of diabetes since birth. He was in diabetic ketoacidosis. That is the life-threatening disorder. He was very serious for that also. He has lower respiratory tract infection. We call it pneumonia. Bilateral pneumonia was there, and he was in septic shock. So and he tested positive. So we cannot contribute that date to the COVID. That is according to me, whatever we have discussed with the people also, and whatever literature says. But he was positive, so we consider it as a COVID case. But nowadays we can see some senior patients who are on a ventilator or coming from the other hospitals also, who are suffering from life-threatening diseases. They may turn out to be positive. But we cannot relate it to the COVID death basically. So that's why I'm telling you the condition of the person, condition of the patient, age of the patient, if he is a comorbid, he is suffering from other diseases. So we cannot basically definitely like in COVID-19, whatever we have seen first or second, particularly in second pandemic, that time we have seen lot of young people were dying, lot of non-comorbid people were dying. That is not the thing with this kind of thing. So definitely these patients will come and we'll get the report, report from the ICU somewhere, the patient who is battling for the life tested positive and he expired. That should be there. So we have to be very, whatever we say, yeah. So that we should not underdiagnose or overdiagnose the thing, and we should not make people panic for this. Basically, I am telling you.
Sir, but are the medical services sufficient to tackle the COVID disease? Because as you told, we have set 40-bed special COVID ward. So are these facilities sufficient?
Ma'am, experience makes man perfect. We always say it. Whatever is suffered in multiple ways of the COVID, so we have all things are there with us basically. Whatever mistakes or whatever things went wrong over there, so we have corrected everything over now. And
Sir, but questions were also being raised during the whole COVID last time that happened, that beds are not sufficient, especially in the Kalwa hospital. So what kind of measures is the administration taking?
so whatever according to the government guideline for the COVID, we created the bed in a whole district basically. We have created many hospitals. You know, in Thane also we have made a hospital in Park Plaza. For the rural area, we have made a hospital in Sawad, and we increased the whole civil hospital was a COVID hospital, and we increased the bed. In a single night, we increased 150 bed in civil hospital also. So there are no issue. See, we are lucky in Maharashtra. I will say it. Nobody died because of a patient didn't get the bed, and nobody died. The admitted patient, no one died because he couldn't get the oxygen or any kind of medicine.
That case happened in Delhi and all those
We
cities.
cannot blame any kind of state or anything basically, but somewhere happened. But in Maharashtra, we are that much lucky and we did it. So we have not seen any such kind of things in Maharashtra, particularly in Mumbai or in Thane district also.
Right.
Yes, ma'am.
So last question, sir. This variant, particularly this variant, what kind of technical details can you give regarding this new variant?
Though these are 4, 5 something subvariants are there, whatever are circulating. Usually when patient come, we test in the antigen. If patient comes antigen positive, there we send the RT-PCR for the genomic sequencing. And according to genomic sequencing, totally Omicron, Delta, and Alpha, everything is gone. Only this is the Omicron, but it's a very mild and is a different kind of. And other reports are we are waiting from the NIV Pune to get the proper report also. So these are looks to be a very mild. And see, virus always gets mutated. So the mutated virus will be there with us. So nothing to go panic, and we have a lot of immunity. We got vaccinated. We got subclinical cases also. So nearly in India, all population have antibodies in their body for the COVID basically. So I don't think to worry about the thing, but people should not get panic for this.